Atenolol versus losartan in children and young adults with moron syndrome. Definition: aortic radiation is a leading cause of death in Marfan syndrome. Studies suggest that with regard to slowly aortic root in ligament, losartan may be more effective than beta blockers. The current standard the therapy in most centers. Video 1. Randomized trial of Atenolol versus losartan in children and young adults with Marfan.
I'm Ron Lockrow, Assistant Professor of Pediatrics at Harvard Medical School and Pediatric Cardiologist at Boston Children's Hospital. I'm here at the 2014 Scientific Assessment Committee on Heart Association to present the results of a trial performed by the Pediatric Heart Network. The name of the trial is a randomized trial of atenolol versus losartan in young children. And the name of the trial is randomized trial of atenolol versus losartan in children and young adults with Marfan syndrome. Marfan syndrome is a genetic disorder of connective tissue which affects about 1 in 5,000 people. Enlargement of the aortic root and dissection or tear of the aortic root can cause premature death. The current standard therapy of Marfan syndrome includes beta blockers, and this became true because of a study published in 1994 showing that propranolol reduced the rate of aortic growth in patients treated with Marfan syndrome treated with propranolol compared to untreated patients. More recently, studies have shown that drugs like losartan, which are angiotensin receptor blockers, may be better at reducing the rate of aortic growth in Marfan syndrome. So our trial was designed to compare losartan and atenolol in children and young adults with Marfan syndrome. We recruited over 600 patients with Marfan syndrome aged 6 months to 25 years. They all met the diagnostic criteria for Marfan syndrome and had aortic roots that were responsive to dilatation. About half of the patients were treated with losartan and the other half were treated with atenolol, and the patients were followed over 3 years. The main finding of the study was that there was no difference in the treatment effect between the two groups. In other words, both atenolol and losartan had the same therapeutic effect in reducing the aortic growth in children and young adults with Marfan syndrome. The study did show that both drugs reduced the severity of aortic root enlargement, and this effect was more prominent in younger children, suggesting that therapy should be started at a younger age. Both losartan and atenolol were very well tolerated, and there were very few adverse events or serious symptoms.
Pros and cons. We conduct a randomized trial comparing losartan with Atenolol in children and young adults with Marfan syndrome. The primary outcome was the rate of aortic root in ligament, expresses that the change in the maximum aortic root diameter scoring the 6 to body surface area over a 3 year period. Secondary outcomes include the rate of change in the absolute diameters of the aortic root, the rate of change in aortic regurgitations, the time to aortic dissection, aortic root surgery of death, somatic growth, and in the size of adverse events.
So the NIH Marfan trial is going to be the biggest trial for Marfan syndrome ever done. It's a trial that's sponsored by the NIH, so it's funded by the federal government, and it's being run by the Pediatric Heart Network, which is a research network that was started in 2001 to try to do research on kids with heart disease with the long-term goal of improving outcome. The Marfan trial was started in 2007, um, and in the course of the trial, we've recruited 608 young children and young adults. Um, half of the half of the subjects are getting atenolol, and the other half are getting losartan. And you know that children and young adults with Marfan syndrome are tolerating both of these medicines very well. In addition to trying to figure out which medicine is better at slowing urinary enlargement, we're going to learn a lot about side effects of the medicine. We're going to learn whether these medicines are helping other parts of your heart, your mitral valve, your left ventricle. Um, we're looking at the effect of these medications on growth, on your skeleton, whether these medicines affect your pectus or your scoliosis. So we're going to learn a great deal, not only about the effect of atenolol and losartan on your heart, but also on the rest of the body. We've all invested time, money, Welcome to AHA Science News. I'm Bob Bono. We're here in Chicago at the 2014 scientific sessions of the American Heart Association, and I'm delighted to be speaking with Dr. Anna Appel-Texas from Copenhagen. She's a cardiologist at Baker's Hospital and currently doing a year or two of advanced fellowship in science laboratory in Harvard and in Boston. So that's all going to be exciting for your career as well. Absolutely. But she's presenting a interesting important randomized clinical trial in hypertrophic cardiomyopathy, appropriately titled INHERIT. Anna, can you tell us about the INHERIT trial?
Yeah, absolutely. The INHERIT trial is a single-center randomized placebo-controlled trial where we investigate the effects of losartan in hypertrophic cardiomyopathy. The primary endpoint is left ventricular mass, change in left ventricular mass for over 1 year.
So this is important because it's not that uncommon to see this in 500 people, as you know, and we're lacking prospective randomized trials in this population. So this is a difficult trial to enroll patients and to follow them.
Well, it's always difficult to enroll patients when there are not so many. I mean, even if there's an estimated prevalence of 1 in 500, we're not following that amount of patients that there should be. But I think most patients were very, very willing to enroll in this study, so that was not hard.
Why did you choose losartan?
Well, the rationale for choosing losartan was that there are some animal studies that suggest beneficial effects of losartan. There are also some pilot studies in humans suggesting effect of ARBs in general. The Seidman group has shown that if with treatment with losartan, you can prevent the development of hypertrophy and fibrosis in a mouse model of hypertrophic cardiomyopathy if you started before the development of hypertrophy.
So tell us how the trial played out and what you found.
Well, we included 133 patients, randomized 50 to losartan and placebo. As for the primary endpoint, left ventricular mass, there was a small decrease in both groups, but there was no difference between the groups.
What period of time?
12.
Application years. A total of 21 clinical centers enrolled 608 participants, 6 months to 25 years of age. Age years in the Atenolol group and other years in the losartan group, who had an aortic group score greater than 3.0. The baseline adjusted rate of change in the mean aortic group score did not differ significantly between the Atenolol group and the losartan group. but slopes were significantly less than zero indications, and the decrease in the earthen root diameter relative the body surface area with either treatment.
Good morning, Brian. How are you doing today? I'm doing good. The doctor just told me I have hypertension. Okay. And do you understand what that is? I think I know a little bit about it, but if you could explain to me a little bit better. Okay. Hypertension is an increase in blood pressure in the blood vessels of a reading of 140 over 90. And your blood pressure today was 152 over 94. So that's a little bit higher than what we want to see it. So that's why the doctor's prescribed you the medication Atenolol. Okay, what's Atenolol? It is a medication to help lower your blood pressure. He's going to have you take 50 milligrams every day at the same time, and then we'll reevaluate how your blood pressure is doing the next visit. Okay, will I have to give myself shots or anything? No, it will just be taken orally in a pill form. Okay. And you just want to make sure that you don't skip any doses. You want to take it every day at the same time. Okay, can I take it with breakfast? Yes, it does not matter if you take it with or without food. Just make sure before you take it, we want to have you count your pulse for 4 minutes. And if that is 50 beats or less, then we do not want you taking that medication for that day. Okay. And I do know how to take my pulse, but what's considered the normal range? The normal range is going to depend on age and activity level, but we generally say between 60 and 100 beats per minute. Okay. And are there any side effects I should know about? There are weakness, fatigue, erectile dysfunction chills. Okay. And then there's a few more severe adverse reactions that we want.
Conclusion. Among children and young adults with Marfan syndrome who were randomly assigned to losartan or atenolol, we found no significant difference in the rate of aortic root dilatation between the two treatment groups of over and 3 years period. Issues applied. The 3-year rates of aortic root surgery, aortic dissection, death, and a composite of these events did not differentiate between the two treatment groups, and that's it.